Welcome to video 2 of chapter 5. And in this video, we will be concentrating on health issues and risks to the prenatal development. This second section does start off with the 3 trimesters of pregnancy. Make sure you do not get those confused with the 3 stages of prenatal development that we went through in the first section. The 3 trimesters just refer to three-month periods. Most people are familiar with them. Your book does not go into very much detail, so you don't really have to know too much more than really what's written on the screen here. So I'm not actually going to cover these trimesters. There is much more detailed information in the videos on Blackboard in the other videos section. So make sure you do learn about the 3 trimesters on your own. Okay, so now we'll get into the health issues and risks that can affect prenatal development. And certainly the first one is a major risk, miscarriage or spontaneous abortion. This refers to the natural loss of a pregnancy before the fetus reaches a gestational age of 20 weeks, approximately 5 months. Many factors may cause miscarriage. When a miscarriage happens during the first trimester, during the first 3 months, approximately between 50 to 80% of those that happen in the first trimester are caused by chromosomal abnormalities. So sometimes when sperm are being developed, or when by the male, or when ovum are being developed by the female, her eggs, sometimes there's mistakes made in the genetic machinery as these sperm and eggs are produced, where sometimes a sperm or an egg may include an extra chromosome. They may be lacking one or more chromosomes. Sometimes there are chromosomes that may experience breakage. And so there's a number of chromosomal abnormalities that can occur either in the production of the sperm and the eggs, or when fertilization happens and the sperm and the egg unite, and the chromosomes pair up. I mean, there's possibility of problems at that stage as well, causing abnormalities. So between 50 to 80%, they say, during the first trimester are caused by some form of chromosomal abnormality. Other possibilities, by the way, are things like mother's drug use can affect chromosomes. Radiation, certainly. So perhaps without knowing she was pregnant, the mother went in for an X-ray, and the embryo was exposed to low levels of radiation. So I mean, there are a number of possibilities. So in many cases, the cause of a miscarriage is unknown. It's not like autopsies are regularly done on miscarriages. So often doctors are just tell the parents, some probable causes, such as chromosomal abnormalities, or but in many cases, it's just a mystery, and doctors are often left saying it's just something that sometimes happens. Okay. Several factors are important to promote a healthy pregnancy. We're going to look at a number of these maternal health factors, including diet, exercise, sleep, and stress management, as well as prenatal medical care, which I'll deal with first. And statistics show that women that without prenatal medical care are 3 times more likely to give birth to a low a low birth weight baby, which can lead to problems in development, including things like increased risk of infections for the infant. So 3 times more likely to give birth to a low weight baby, 5 times more likely to have an infant that dies, which is pretty harsh, but 5 times more likely. And the reason why their infants are more likely to die is that the mistakes were made during the pregnancy, lack of proper diet, lack of proper nutrients, um, uh, using medications that can affect the pregnancy and the developing fetus, and etc. I mean, these are things that get cleared up in prenatal medical visits. You go over, what your regular drugs are. There are whole volumes written about which drugs are safe during pregnancy and which ones aren't. And so sometimes a switch can be made very early on if you happen to be taking a prescription medication that is on the unsafe list. And so, not taking folic acid, including folic acid in the diet. I mean, there's just a lot of things that an expectant mother will learn during her prenatal medical care visits. And so it's incredibly important that if you ever work with any women during the pregnancies, that you really push hard on this point that they get in for prenatal medical care. Okay, next we'll look at diet. And a well-balanced diet, as it says here, is essential for both a mother and her baby during a pregnancy. The mother should consume approximately 300 extra calories per day. During the course of the pregnancy, she should gain on average between 25 to 35 pounds, is considered healthy. And the goal, if the mother consumes the proper calories and gains the proper amount of weight, the goal is to have a newborn somewhere between 7 to 8 pounds. Infants that are born smaller, as I was already talking about earlier, if they're born smaller than that, then they're more vulnerable to infections. And there's a huge difference between, let's say, a 4 or 5 pound baby versus a 7 or 8 pound baby. I mean, there's just huge difference in the number of things that can go wrong with a low birth weight baby. Pregnant women also need to have adequate amounts of vitamins and minerals. Folic acid is one that's considered incredibly important. Okay, that's all I wanted there. Exercise, appropriate amounts of exercise can be beneficial during pregnancy. We've come a long way from oldie times, where pregnant women were encouraged to have bed rest and to laze around as much as possible during the pregnancy and stay in bed or on couches. And we've come a long way. Science has shown that exercise is beneficial to the pregnancy, and especially if a woman was exercising before she became pregnancy, she should maintain her exercise schedule and do the same types of exercise that her body is already used to. Now, sometimes you might, decrease the intensity of the exercise somewhat, but it is very beneficial to continue any exercise that you previously regularly participate in. And this can even be things like a woman who weightlifts. I mean, if she's a regular weightlifter, she can weightlift during her pregnancy. I mean, a lot of people think that's really dangerous or something, but it's not. I mean, if the body's already used to that kind of exercise, if you normally swim, then you continue swimming during the pregnancy. If you run, you can continue running. I mean, so it is. Doctors now encourage women to exercise during the pregnancy, and once again, especially if they were doing so beforehand. And this is true right up until the day of delivery. I remember when my daughter was being born, and I mean, they had um, her mother, get up and like, walk the halls and move about, to try to encourage some more dilation and to just kind of speed the pregnancy along a little bit. And so they had her like, not staying in bed on the day that she was in labor, but to actually get up and move about and this is seen as beneficial once again right up till the end of pregnancy. Okay, now let's go on. Teratogens, the next topic. Teratogens are agents that can disrupt prenatal development and cause malformations or termination of the pregnancy. So basically, teratogens are harmful substances from the environment that can affect the pregnancy. This chart is in your book on page 145. I need to point out that there is a mistake in this chart. They mixed up the colors. So they have the blue bars as labeled as less sensitive periods and the orange bars as highly sensitive periods. That should be reversed, okay? So the highly sensitive periods come earlier. They are the blue areas. The less sensitive periods come later. They are the orange areas. So the mistake is, I left it on the slide because this is a duplicate of the textbook. So I don't want you to get confused when you read your textbook. And so make a note of that. I talked about how the embryonic period was a critical period in development because all these different systems were beginning development and they were going through rapid initial development, putting those systems at risk. You can see all these blue bars, really sitting within the embryonic period. So the embryonic period ends at number 8 along the top at the end of the 8th week, and you can see that most of the blue areas are within the embryonic period when when these different areas of development are high at risk and they're highly sensitive. You can see that the central nervous system, continues to be at risk much later. Once again, the development of the brain it is the most complex human organ, and there's so much that goes into the development of a brain that it takes much longer to reach a point where the risk is reduced. You can see all the way up to the end of week 16. So, it's an extra couple of months of risk for the central nervous system. Most of the other ones finish before the fetal period, the high risk areas at least. Remember, as I did say in the last video, it does not mean that the risk has gone away. It just means that the risk is reduced somewhat as you get into the orange periods. Okay. Let's look at some examples of teratogens. And alcohol is certainly one of them. I'm pretty sure that most of you would be aware that alcohol should not be a part of a pregnant woman's diet. You may hear doctors say, well, yeah, a little bit's okay, and things like that. Especially if they think the woman's going to drink anyways, they might just try to tell her that that as long as she really controls the amount. But the correct and proper answer is that you shouldn't be drinking alcohol at all. And it really, the more steadfast and stern doctors will say, do not drink any. And this, there is no benefits during pregnancy to alcohol use, and there are only possible harmful effects. The effects that do occur due to maternal drinking during pregnancy are once again permanent and irreversible. When effects do happen, it's not like you can, it's not like they'll grow out of it or they'll catch up in development and they're just behind. I mean, these are types of damage that will never be recovered from. So you could be starting a child off before they're even born on the wrong foot, basically putting them in a hole intellectually, or I don't know, you might be affecting their emotional system or their stress system. There's different things that do get affected. But for alcohol, it is more cognitive deficits, thinking deficits. Let me go through a few of the symptoms. So for alcohol, it's called fetal alcohol spectrum disorders. When you see the word spectrum, just like in autism spectrum disorders, it means that there's a wide range of disorders in this spectrum, from very, from less serious to more serious. Fetal alcohol syndrome is the name of the most serious of these. So just like when we talk about autism, like something like Asperger's is a more mild form of autism. So fetal alcohol syndrome is the more severe form of the spectrum. And the symptoms, well, first of all, the cause of fetal alcohol syndrome would be heavy or binge drinking during pregnancy. You won't get, this top disorder with the occasional sip of wine, or, like if you were really monitoring how much alcohol you had, you would be lower down on the spectrum. The babies that end up with fetal alcohol syndrome, once again, it comes from heavy drinking or binge drinking, which is a lot at once. Some of the typical symptoms are abnormal facial features, a small stature, so it kind of stunts the growth, small heads, the heads are smaller than normal, and then cognitive deficits, such as deficits in learning, memory deficits, attention span deficits are common. And emotionally and behaviorally, often fetal alcohol syndrome children have trouble controlling their behavior and trouble regulating their emotions. So there's a variety of symptoms. Some of them physical, like the facial features and the smaller stature. Some of them cognitive thinking disorders, and some of them are behavioral and emotional disorders. And these are all possible with fetal alcohol syndrome. Okay, now tobacco. This includes secondhand smoke. Asthma is a very common effect from a fetus being embryo or fetus being exposed to smoke. Other respiratory problems, of course, are possible as well. SIDS becomes more likely. That stands for sudden infant death syndrome. We will talk about that at a later point. ADHD, attention deficit hyperactivity disorder, and learning disabilities are all more likely if a mother smokes or she is exposed to secondhand smoke during her pregnancy. Then there are prescription and over-the-counter drugs. Oh, actually, let me add to that list for tobacco. I'm sorry, I just looked at my notes here. Other things are more likely as well. Miscarriage becomes more likely. Premature births, and also heart defects. The risk of those three things are also increased. Miscarriage, premature birth, and heart defects due to tobacco use or secondhand smoke exposure. Okay, prescription and over-the-counter drugs. The effect of the drug, you should say, depends on the specific type of medication that's used. Obviously, different drugs have different levels of effect, different types of effect. When in pregnancy it's taking, so this goes back to the critical period idea, far more damage can be done if it's taking in that 2 to 8 week period following conception compared to if it was taken towards the end of pregnancy, for instance. It's, harmful substances, if they can be avoided, should never be taken. But even things like, just going back to something like alcohol, more damage would be done if you drink a lot in that embryonic period, that critical period, then if you drank in the 8th month, let's say, there can still be damage. I don't want to minimize it, but it, just like these prescription drugs, most of these tratogens, it depends on when the exposure happened. So when the drug is taken makes a big difference. And how long it's used and the dosage, of course. You know, if you use more of it, if you use it for a longer period, you just increase the risk of possible damage. As I mentioned earlier, there's often substitutes for drugs that are possibly harmful during pregnancy, and they do have lots and lots of material written about. They've tested, I would say the majority of drugs out there. We had when my ex-wife was pregnant with my daughter. I mean, we had this huge. It was like the size of an encyclopedia. Like there's a huge volume just going alphabetically through hundreds, or I don't know if there were maybe thousands, but at least hundreds of drugs in this book, and probably thousands. And what we knew about each drug. So some of them were unclear. There hadn't been enough research. Some of them were definitely harmful. Others we knew not to be harmful. And you could look at, your normal drugs in these books and figure out whether or not they are safe. My ex-wife ended up switching her depression medication to a different type. Illegal drugs, certainly bad. For example, cocaine can cause withdrawal symptoms in the infant, a poor cry signal, and brain and cognitive problems. Marijuana can cause tremors and long-term cognitive problems. Okay. I'm not going to say anything else about those. Diseases. There's a number of diseases that can be very, very harmful. HIV/AIDS is certainly one of the ones at the top of the list. It can be passed to the fetus during the pregnancy, or it can be passed to the fetus during the birth process. And so typically if a mother has HIV or AIDS, you automatically go to a cesarean section delivery. The third way it can be passed is through breastfeeding. So it is recommended any mother with HIV or AIDS not to breastfeed, definitely not to breastfeed. So these 3 ways. It could be during the pregnancy, during the birth, or while breastfeeding. Another particularly harmful disease is neonatal herpes. So if an infant has herpes, it's called neonatal herpes if it's an infant, it puts them at risk for neurological damage, intellectual disability, or death. So if an expectant mother has a case of genital herpes at the time of delivery, just like in the case of AIDS, the baby would usually be delivered by cesarean section rather than through a vaginal delivery, because the herpes could be transmitted during the delivery. Okay, I'm going to go on. I know German measles is another really bad one. I don't remember all the details about it, but you could jot it down. German measles, another bad disease. Maternal stress can be a problem during the pregnancy. The mother's stress hormones can act as teratogens and be harmful substances. So when a mother is under stress, she produces the hormone cortisol, which is similar to adrenaline. But anyways, and cortisol can pass. We know it can pass through the placenta to the fetus. So it is something that can be transmitted from the mother to the fetus. And so if the mother goes through long periods of stress, or or very intense periods of stress during the pregnancy, it is some of the results are slower growth rate for the baby, having a low birth weight baby, and having a baby with temperamental difficulties. In fact, when the mother passes stress hormones to the developing fetus, it can mess with that that child's stress response system, which is why it often shows up as temperamental difficulties. They will often cry a lot. They will be hard to console at times. They will often show very stressful responses to even minor things, because her stress hormones actually kind of can mess up the baby's stress hormone system, which makes it hard for them to control their emotions. Finally, environmental toxins are another teratogen, and this includes X-rays. The X-rays produce a low level of radiation, which can really mess with pregnancies. This is why if you ever go in for an X-ray, if you're female, you go in for an X-ray. It's always one of the major questions that they ask you. What else here? Endocrine disruptors. These are chemicals that interfere with the functioning of the hormonal systems of the body. And endocrine disruptors include such things as household cleaning products, insect repellents, pesticides, nasty air pollution sometimes, if it's bad enough. And besides interfering with the hormone system of the body, disrupting the endocrine system, which is our hormone system, as mentioned here, it can be associated with a variety of physical and developmental other developmental problems as well. And that's all I am going to do for section 2 of chapter 5.